I was one of those kids that knew he wanted to be a doctor very early on, and I worked with a couple of orthopedic surgeons as a teenager in high school. When I got into undergraduate school and then ultimately into medical school, I was fortunate to work with a couple of hand surgeons at my institution because I knew I wanted to go into orthopedic surgery. So the closest to orthopedic surgery that they had from a mentor standpoint was a hand surgeon, and that's what really piqued my interest. I thought it was fascinating because it's a very meticulous field, it's a very narrow field, so I thought I could really hone my skills and become very good at something very specialized, but it's not such a boring field because there are so many different aspects of hand surgery, anything from microsurgery to fracture care to tendon repair, so it really runs the gamut. Microsurgery is the use of an operating microscope to help assist with the repair of whatever you're trying to fix. So in the hand surgery world, that generally involves either fixing a nerve or an artery. We can fix the nerves and arteries to put a finger back on, or just if a digit is partially lacerated or cut, we can help repair part of those structures. So we use those microscopes because the suture that we use to put those structures back together is so small that you can't see it really with the naked eye. The most common hand problems that I see in the clinic include carpal tunnel syndrome, which is where the nerve in your hand has pressure on it, thumb arthritis at the base of the thumb, it's very, very common, and something called trigger finger, where the tendon doesn't really slide through the tunnels in your hand and you get a clicking of the finger when you try to bend it. Carpal tunnel is essentially pressure on the nerve in the hand. We don't really know exactly why it occurs. There's about 90 different theories in the world, but nobody's been able to ever really show exactly why carpal tunnel occurs. We do know that there are any number of different reasons that people can get it, and back in the 80s and 90s it was popular because everybody thought it was associated with a computer or the keyboard. We know now that's not necessarily true. The recovery time for carpal tunnel varies from person to person. It also depends on your definition of recovery. The wound does take about 2 weeks to heal, but during that time I do ask that the patients are moving their fingers, and they can use their fingers and their hand for light use, such as writing and typing and eating and drinking. After 2 weeks they return to the office, and we generally take out their sutures at that time, and they can start to increase their activities. However, I would not recommend doing any strenuous activities such as golfing or any significant lifting for about 4 weeks after surgery. When patients arrive at the clinic and they have complaints of carpal tunnel or any of the other common hand conditions, we generally try non-operative measures first to help with their problem. Although this doesn't always work, and so sometimes surgery is necessary. We do try to provide education ahead of time before the surgical procedures. We have different pathways that we've developed through our excellence through evidence approach, and this also helps prepare the patient for getting ready for their surgical date. Some of the things that we provide is educational forms. Occasionally, if patients have some stiffness in their hands before surgery, we will actually send them to therapy ahead of time to help maximize the result postoperatively. Banner's been an excellent partner with CORE for many years. We have multiple orthopedic offices at Banner facilities or near Banner facilities, and they have been very responsive to helping improve the patient experience through their hospitals. I think they recognize that a partnership between the two organizations is really a match made in heaven, because our goals are aligned with regards to help improving patient outcomes and experiences. Some of the metrics that CORE and Banner are measuring through this co-management agreement include the ability to measure when antibiotics are given preoperatively, as well as making sure that patients are covered postoperatively with the appropriate blood thinners for prevention of blood clots. These are just some of the measures that we're looking at. The other things that we look at, of course, are patient experiences as well as patient satisfaction scores, and hopefully all of these measurements and this work will hope to improve the patient's experience as well as the patient outcome. I chose CORE to come back and practice at because when I first interviewed with them, it felt like a family. I joined back very early on in 2005, although I didn't show up until 2007. I was still in residency. But when I showed up for my interview, there was only about 7 people that had joined CORE. It definitely felt like a family, and I knew that all of the physicians really had the same goal in mind, which was to really provide good orthopedic care, excellent orthopedic care for the area, which was in great need at that time. When I came back to join CORE, I was the first hand surgeon that joined here, and there was a significant need in the region for hand surgeons. Arizona doesn't have many hand surgeons in the state, but certainly in the West Valley there were hardly any hand surgeons at that time. Over the last 5 to 6 years, we've really developed quite a big program and have 6 hand surgeons at the CORE Institute at this point. All of our hand surgeons are fellowship trained and are working not only in the clinics and in the operating room, but also many of the surgeons are developing research projects and working on research for medical journals.